Good afternoon, everybody, or morning, depending on where you are. It might still be morning. So I'm Paul Hunziker. If you haven't met me before, I'm going to be, Leah and I are going to be presenting today talking about our clinical supervision, our second run of our 4-state tribal clinical supervision immersion program. So it's an informational session that we'll go into here, and we're going to definitely have plenty of time for questions and answers. So I'm going to meet folks as we go through. Let me move some slides forward here. So yeah, we can definitely take questions as we go. You can, by all means, feel free to put questions in the chat box. Leah and I will be watching that, and we'll definitely answer questions as we can. And there's going to be definitely plenty of time for discussion and questions at the end. So again, welcome. Yeah, we're excited to be able to run this again. It was a great success last year. And we definitely are looking forward to getting another chance at working with all of you. So what I want to do here, let me introduce myself again. I'm Paul Hunziker. Pronouns would be he, his, him. I am a marriage and family therapist and a substance use disorder professional here in the state of Washington. I currently have a private practice here in Tacoma, where I run about half time there. I work with clients as well as supervisees. I've taught supervision for ATTC since I believe it was about 2015 is when I started doing that. So I've been teaching it for some time, and we've made adaptations as we've gone along. I also am an American Association of Marriage and Family Therapy approved supervisor. So I do provide that as well. Leah, if you could introduce yourself, that would be wonderful.
Hi, everyone. I am Leah Nicolati, and I'm a licensed mental health counselor. I'm also a licensed substance use disorder professional. I've spent the majority of my career working in tribal communities, so about the last 10 years. I've been a clinical supervisor since 2015. I really enjoy working with supervisees, providing coaching and consultation and ongoing support. So that's a little bit about me. I am from Washington, from Tacoma, Washington, to be more specific. And yeah, I'm really happy to be here. I'm glad that we're doing this again. The last time was a great success. And I do see one familiar name on here. And that's James. So anyways, glad to see you, James. And I look forward to learning about everyone else on here. So thanks.
All right. Thank you, Leah. Yeah, fantastic. All right. So let's move ahead a little bit here. Great. Thank you, Wade. Yeah, if folks want to introduce themselves on the chat, please feel free to do that. That would be wonderful. We'd love to hear a little bit about you through chat. So what we're looking at here, kind of looking at kind of supervision and offering this course and kind of who this is for, who it's meant for. So of course, it's for clinical supervisors. Yes, substance use disorder counselors is because especially with the materials that we're using are kind of focused on addictions counselors. However, it's really much more broad than that. We've had folks historically, peer support specialists, parent partners, behavioral health aides, mental health counselors, other marriage and family therapists, social workers. We've had a really broad range of folks attend these sessions and get a lot from it. So, and if you do co-occurring work, it can be a really great piece in there. So it's basically anyone involved with the behavioral health field could find something useful from this. Also looking in here, when we put this together, we put it together with all 4 states in mind. And so like one example of this is the fact that we made absolutely sure it has 30 hours of material. That is specifically for Alaska. So that is because Alaska has that a specific 30-hour requirement. And there are other little bits and pieces that we've added through that make sure that it meets the qualifications for each of the states. And also Leah and I have worked extensively on adapting this, and we continue to adapt it as well to try to make it as relevant and useful for folks working within a tribal environment or working within the villages or some working in an environment such as that and be able to use this. All right. So it's quite a commitment. So it is a 6-month long program. And so this was why we call it an immersion program. So kind of reading the slide here. So it's a 6-month long full immersion program in clinical supervision intended to introduce participants to the model of supervision and familiarize participants with competency-based counseling, counselor skill development, prepare the participants to be highly qualified clinical supervisors and to meet all of the 4 states guidelines for being an approved supervisor. So that really, it does encapsulate the whole process here, all 6 months there. Yes, it is limited to 30. So we definitely want to keep it within a certain range here because it is important that everybody gets personal attention. And you're going to see as we lay out the program how that happens and also why we need to limit it in size at least. So it's broken into 2 parts. The first part is it starts out with a 2-day full Zoom training. So yeah, it's quite long. It's a very interactive training. We do a lot to try to mitigate some of the difficulties with Zoom fatigue. So you're not on staring at your screen constantly, and there's a much more interactive component, which tends to help a lot with that. So there's a lot of material there. And then that's followed up with 4 follow-up 1-hour meetings. And so those are they occur every other week, and they'll be scheduled. We'll talk about how those will get scheduled because there's going to be some options for those. But yeah, they'll occur about every other week. And so that ends up going for, I believe it's about that will be a month. And then part 2 starts. And that is kicked off with a full day training. So just a 1-day, not a 2-day. And then after that is where it gets into the really long immersion. It's 8 follow-up 1-hour meetings. They happen every other week. So this is where it extends out for quite a lengthy period of time. And that's actually a mistype there. It's actually 2 individual, my apologies. It's 2 individual supervision coaching sessions that will be offered during the second portion as well. Now individual will likely mean that the participant will be paired up with another participant. So it'll be 2 people plus either, most likely Leah or possibly myself, but it would be one of us leading that. And you would get individual attention around supervision, maybe practicing some of the skills that we've learned, talking about situations that you're having and trying to figure out how to handle certain supervisory situations. But it's individualized there. So as for the dates for this round, so the initial 2-day training will be on March 9th and 10th. And so that's the kickoff to the whole, the entire program. There is the 4 follow-up sessions look like they'll be occurring on March 22nd, April 5th, as well as the April 19th, and then May 3rd will be the last of the follow-ups for part 1 at least. Those are all Tuesdays. As for specific times for that will be determined because there's going to be some options potentially presented to participants to offer some flexibility with time to find a time ideally that will work for them. Part 2 starts out, that full day training will occur on May 20th. And then again, the 8-hour follow-up sessions for that, or 8 1-hour follow-up sessions for that, will be again May 31st, June 14th, as well as June 28th, July 12th, as well as July 26th, August 9th, as well as August 23rd, and then the last one will occur on September 6th. And then those coaching sessions, the individual coaching sessions, will occur somewhere during that phase, but those will be scheduled individually with the participants. So there's not a set time for that yet. So that is everything laid out. It is quite extensive. At the same time, participants have found that the regular, consistent follow-up has been really helpful with adopting the skills and kind of keeping the training alive, and really learning how to infuse this into their work. So just objectives really quick here for part one. Part one, we kind of think of as counselor development. So this is really looking at kind of how we build exceptional professionals. And so here, yeah, we're going to look at the research that supports supervision methods, what's available at least. We're going to identify the roles that we play within the supervisory relationship, because there's a number of different hats that we wear. It's a lot more complex, as many of you, probably, if not all of you know, as a supervisor. It's different than being just a regular clinician or counselor. We're going to increase awareness of culture and supervision, and add definitely working within a tribal environment and kind of working how to be effective in that environment. Practicing skills, and we have some specific skill sets like feedback model, professional development plan development, as well as supervisory interview, which is essentially their individual supervision sessions. And so we're going to look at each of those. We've got some models to work with, and we'll talk about how to adapt them based on what your setting is as well. And then lastly, we're going to gain familiarity with available resources for supervision. So then in part one, there's the 4 follow-up meetings. We're going to basically review a lot of that material we might of what I just showed you with the objectives. Part 2 will add some new components in. So we're going to add and look at the addressing framework. We're going to look at an MI specific consultation method. We're also going to look at corrective interview. So this is essentially where supervision is not going as well as you would like, and kind of how to handle that. Part 1 is how do we develop great counselors? Part 2 is how do we develop situations that are maybe challenging or difficult to work with at times. And so corrective interviewing is one of those components, as well as ethical dilemmas and boundary issues. Also added to the addressing model piece, there's going to be an emphasis on how to have culturally based conversations as well with supervisees, and some tips and methods for doing that. So then tools, so with that, have that feedback model, which will give you a method for providing feedback. Also ways to give objective feedback. Well, as objective as we can, because all feedback is subjective. But we're going to provide some tools and talk about ways to make it less subjective and make it easier for supervisees to take in and work with. We'll also look at ways to build professional development plans and ways to be effective in needing to be more directive. So that's where the corrective action will come in, and at deciding at times when, as a supervisor, it is really important to take on more of that directive piece. We want to reduce that as much as we can, and figuring out how and when to do that. And then lastly, providing tools to help deepen cultural diversity related conversations. So that's a quick review of some tools. Also, during the follow-ups, there might be other tools and other things that are brought in based on the group's need. So one of the great parts of having this extended process here is we can update and add things in that come up that we realize are going to be useful for the specific group that we're working with. So we're going to use a number of different learning methods. Of course, didactic, we'll definitely have plenty of lecture materials, but a variety of them. Lots of practice and skills training. We'll have some live experiential training sessions, so that will be the individual meetings that will occur. We might do role play there. We might do, there's a number of different things that we can do that will be live and experiential. Also, the small group learning sessions, those will have a lot of discussion, and we'll be using the skills real time. So we'll be talking about what it's like to apply the skills as it's happening. And then lastly, some direct observation combined with individual coaching, and that will occur in those individual sessions as well. So coming towards a close here, I'm going to come out of share. Got quite a meeting here. It's great to see everybody. So I've got some contact information up there, and I want to double check that as we go through. Leah, is there anything you would like to add?
Hi, everyone. Yeah, I had some thoughts while you were talking, Paul. I just wanted to add, I think my favorite parts about the training is that we get to have a space to talk about unique challenges, successes going on in your community. It's a chance to network with professionals at other tribes. And over the six months when we did it last time, I really saw a lot of the participants take advantage of building those connections, and looking forward to those follow-up sessions and the individual sessions. So it was something that was really worth their while in a lot of ways. So I think the small group activities, there's also a lot of opportunity for small group activities. So you don't have to listen to Paul and I talk all day. So that's really a good thing too. And I think that's pretty much all I would add, Paul. Yeah, that's about it. Thank you.
Thank you. So it is time that runs through the program. It presents kind of a quick thumbnail of what we're planning on doing. It is open now, and I'm wondering if questions or comments that folks have. Okay. Great. And just, yeah, any questions or thoughts or anything that people want to ask, please, yeah, go ahead and unmute yourself. It looks like Eric, are you looking to say something? Oh, maybe not.
Can you hear me?
Yep, we can hear you.
Okay, I saw something in the slide presentation about deepening a cultural connection. Was that almost on the right path there?
Yep.
What does that mean? Like, are you supervising a non-Indian or something? Where there's some additional information that needs to be expressed to the individual?
So that's a really great question, Eric. And so, yeah, I think that's what we kind of go over is supervising non-Indians. We go over ways to build up competencies in those counselors to help them be more, not just culturally aware, but how to make it more supportive of your community. Okay. And where are you from? Where are you at right now?
I'm in Yakima County area. I'm with the Yakima Nation tribe.
Okay. So yeah, so one of something that you will work on is, you might have scenarios or examples of counselors that you're working with or people you're supervising in general that you can work to build those competencies, those cultural competencies specific to the Yakima Nation. Mm-hmm. Not just, that stuff, that's really important. Some of the challenges that we deal with are, staff turnover, staff who haven't worked in tribal communities before adjusting to tribal communities, dealing with the challenges of folks' sort of preconceived ideas or notions, all those things. And it really can help, retain staff that you're, looking to work with. How do we identify as a supervisor, is this something that I need to take out my HR policy manual on, or is this something that I am going to be investing as a supervisor with this person? So in that way, the clinical, this training is really great. Not just getting Paul's feedback and my feedback, but more importantly, other people's feedback. And that's been a really, I think, one of the richest benefits for a lot of participants.
Okay. Yeah, thank you. Thank you.
Yeah. Mm-hmm.
Other questions or thoughts? So I know part of our present, oh, it looks like, okay, so it looks like there might be some questions about conflict. And that actually kind of dovetails with where I was going, so like timing conflicts. So I think a couple of pieces I may have left out. For the first part, with the follow, of course, we would need you to attend both of the full day trainings. But with the follow-up meetings, you would have to attend 3 out of the 4. And then also with the 8 follow-up meetings, with part 2, there's the full day training, which we would need you to attend. We had some challenges where someone wasn't able to attend last time, and we had to figure out how to make that work. We were able to, but we had to move some stuff. It tends to be best if you're able to attend that full day training, and then the 8 follow-up meetings, you can also miss 1 of those. So you can miss a total of 2 of the follow-up meetings. So I'm not sure if, I think Wade, there's a question about training conflicts. If the conflicts are specifically with the follow-up meetings and you're not going to miss more than 2, you're fine. And honestly, with this as well, we talk, that is to get the CEs and also to meet the state guidelines. If you miss more, that's okay if you miss more than that, as long as you're not needing to meet those guidelines. And Leah and I will track how folks are doing and regularly check in with folks to see how you're doing with hours attending, and making sure that we're on track. And a question we'll regularly ask is, are you looking to do you need a specific set of hours? Like in Washington State, you need 28. And so we can work with you on that. In Alaska, you need the 30. I can't think off the top of my head for Oregon and Idaho. I know I've looked it up in the past. I can find that again, but yeah, we'll be communicating with you on that though. Any other questions or, yep, Teresa?
Hi, sorry, I've been doing my best to stay engaged, but I've gotten a couple door knocks, so I apologize if I missed that. I know, right? I'm sure we all know what that feels like.
Yep.
Is there a cost associated with this, or as part of the programming is that there isn't a fee associated with it?
So I'm not aware of a fee being associated with this, and please, we've got Dina is coming on. Thanks, Dina.
Yeah, no, this is sponsored by the Northwest ATTC, and we're federally funded. So, yeah, so there's no cost associated. But
I love it. And then, what was my other question? I'm gonna have one of those days today. I feel it. I'll pipe up if I remember what it was. Thank you.
Well, Paul, you mentioned 28 hours in Washington State. Is that 28 hours to be a supervisor? Training that you need?
So to be and this is well, I guess it's under DOH, Department of Health now. In order to be a designated clinical supervisor for a state certified agency in Washington State, you have to have either 28 hours of training, and then there are some other routes to get there, but having the 28 hours of training is on there. It's usually best practice, and frequently when folks come in, site monitors come in, they're looking that you've had that 28 hours. Yeah.
Thank you.
Yep. So there's a question, it looks like from Julia, do you anticipate that the training will fill up? If it's any indication from last year, yes, we had a completely full training and we were able to work with folks all the way through as we went. Yeah. Friedrich, it looks like it's good to see ya.
Likewise. So, so my question is with regards to this training. So this is just general supervision training, not targeted towards a specific modality or licensure or credentialing. Is that correct?
Yeah, so I mean, it's an addictions focused one, so it does have, and it will go in that direction. However, at the same time, I've had plenty of folks use it in a broader sense.
Sure.
Granted, I don't know in Alaska how that all works with that, but it would meet Alaska's requirements for CDCs. Yeah.
Great. Awesome. Thank you.
Great. Teresa, you have another question?
I remembered my question, thankfully. Is there a cap on number of participants from an agency?
I'm not aware of. No. Yeah, there's, yeah.
Okay.
Yep.
So just until it's full. Okay.
Yeah, that's it.
Thank you.
Yep. I'm trying to check chat here to see. Okay. Any other questions?
So this is Wade again. So if you're already a supervisor, all of this is for like new supervisors, people that are coming up being supervisors, or because I know that there are a lot of people that are already supervisors. So I mean, they're going to grandfather into it as far as DOH is concerned. Sure. You know.
So, yes, we do. It's a foundational supervision course. So, I mean, yes, folks coming in that have experience are going to be getting some review. Now, that being said, in the 7 or so years I've been teaching this, I've had a lot of experienced folks come through and have really appreciated the structure and feeling that this supervision training is particularly good for agency-based work as opposed to private practice. And so that's usually been one that folks that with experience have said it's been helpful because they've felt like they've come away with more concrete structured tools. So that's worked, and for folks that have come through in that regard.
Sounds good to me.
Great. It looks like Tessa's looking up some stuff for Oregon specifically, and it looks like there's 12 hours per year. It's really around, oh, and you found it for Idaho too. Fantastic, 15 hours per year. Now, actually, as you were mentioning Idaho, I know there can be a specific thing in Idaho for advanced supervision. We can talk about that if you have questions about that, because our part 2 does get into some more advanced stuff, and I've had folks have success with that in the past, having that counted. I know that's one state that is a little bit differently and designates something specific for advanced. So. All right, any other questions?
Paul, there was one question about registration in the chat, and I did respond there, but we do hope to have the flyer with the registration link completed in the next couple of days. We'll run it by you and Leah and make sure it looks good. All the dates are correct. And I was thinking one thing we could do is just send it out to this full group as soon as it's ready. So they'll kind of have, maybe we'll send it out to all of you for first chance to register, and then we'll be distributing it through a larger group in our various mailing lists.
Yeah, and I just want to say that there's 25 participants on here. I look forward to seeing 25 registrations. And I look forward to working with all 25 of everyone on this Zoom call. It's gonna be great. You're gonna absolutely love it.
Yeah.
And I get the privilege of working with everyone. And so I get a good benefit from it too, because I get to learn about what everyone's doing and witness and share in your journey, professional, and sometimes there's some personal stuff that comes up, and some support for one another. So I really am excited about this next immersion training. So,
and one thing that Paul didn't and Leah didn't mention is that that we have sponsored also a clinical supervision ongoing group consultation group, so that once you all are finished, you're eligible. We plan to continue to support that, are eligible to participate in that. So it just really, I think, helps create that network of other people who may be struggling with some of the same challenges or sharing successes. So that's just another follow-up to support use of this model.
I've had a great response with that. I've had people in there that have been involved with this in some way for a few years now. So yeah, it's been a great community.
How frequently do you guys offer this program? Like how often?
So far, it's been about once a year. We did our first run last year, and this is now our second opportunity.
Thank you.
So pre-pandemic, did you guys do this online or in person? This training?
Immersion, no. The immersion actually started, the idea for it started a little bit pre-pandemic, but it really came into gear in that. Now, I did a lot of in-person training with supervisor trainings previously. So yes, there was a quite extensive in-person program previously, but the immersion was an add-on that started last year. Or actually 2020 was our first one. We did another one that was not tribal focused. So we did another one before that, yeah. All right, any other questions? So for folks that haven't seen this today, there's gonna be a recording posted online as well. That's why there's the recording happening. And Dina, thank you so much. And I don't know, we didn't introduce Dina. Dina's the co-director of the ATTC. I'm so sorry we didn't introduce you there.
No worries.
Yeah. And so, yeah, the registration should open up. We'll get a flyer out. Sounds like we're going to get the flyer out to all of you first, and then in the coming weeks here. Also, the slides, we'll see if we'll post those as well, or we can give access to those. My contact information's on there as well, but ATTC is going to be who you contact for registration. And that'll be on the flyer, I'm assuming. Yeah, all of that will be there.
Yeah, and I think somebody had just asked the question about the recording. Yeah. And I think that may delay a little bit because it'll take us a little bit of time to kind of save the recording and get a link to it. But I think last time, didn't you guys add that onto the flyer so that people who wanted to sign up could watch it? So it'll probably be there again.
Okay. Great. Well, if there aren't any other questions, it's really information that we have today, but look forward to working with all of you. Like Leah said, well, now there's 26 people on here, so hopefully 26 registrants. And yeah, looking at that, and also reach out if you have any questions, whether through ATTC or direct is totally fine. We can definitely sort out if there's scheduling questions or anything else that comes up. All right. Well, if we're set, I guess we can take off for the day. Again, thank you everybody for coming in, and hope to see all of you in the coming weeks.
All right. Bye, everyone. See you soon.
I had kind of a specific question. Is it?
Sure.
I just didn't want to take up everybody's time with the very. So I am a mental health supervisor and being supervised by an SUDP supervisor who is also here. She may have logged off, but I just wondered if is there anything, if we both end up doing the collaborative, is there anything we would need to know or any
or whether you'll be paired together and that kind of thing.
Mhm.
Of course, you can let us know, and we've had this happen in the past, and we do encourage folks if you can let us know that where it comes up is whether you want to be put into the same group, small groups, not in the training itself when we do the full day training. And then we can kind of try as best as we can to make sure that you're in different groups or the same group if that's more helpful. It depends. Everybody's a little bit different with that. And then the follow-up meetings, what folks I see have tried to do is also try to go to different follow-up meetings. And generally we're able to have 2 to 3 follow-up meetings options. So as long as schedules work, we're able to do that.
Okay.
Yeah.
Okay, cool. It seems like it could be a good opportunity for kind of co-occurring
Exactly.
supervision. Awesome. Well, thank you. I'm really excited about this opportunity. I really appreciate it.
Great. Look forward to seeing you there.
Great. Take
Great.
care.
Bye.
Hi, I was just asking
Sure.
in the chat, how do we register for the next?
I'm so sorry. It's kind of patchy. You're saying, are you asking about how to register?
Mm-hmm.
Okay. So registration. So what's going to happen is that Dina, who was on, and Mandy, who is another person that was on here, they work with at the ATTC. They're going to send a flyer out shortly. It should be within the next day or two. They're working on it right now. And it's going to go out to everybody that was signed into this meeting. So you will be on the list to get one. And then from there, it'll walk you through how to do that.
Okay, thank you so much.
Yeah, you're welcome.
Bye.